I'm Dragana Ciric Milovanovic, and I'm a Regional Director of European Office of Disability Rights International. Disability Rights International is an advocacy organization advocating for full inclusion of persons with disabilities worldwide. And we are focusing on monitoring of closed facilities, institutions for children and adults with disabilities. And we have conducted monitoring and published reports in more than 25 countries at this moment. As Ines mentioned earlier, at the beginning of the pandemic, 3 of our organizations joined forces, and we realized that the number of people who are affected by the virus is much higher in institutions and homes for elderly people. And our idea was initially to see what is the situation in institutions, but as our coordinating group grew to include more disability rights groups, the scope of the Disability Rights Monitor also broadened a bit. So on 20th of April, we launched a major global initiative to conduct a rapid independent monitoring. The idea is to identify state measures concerning the impact of COVID-19 on persons with disabilities. The initiative was endorsed by the UN Special Rapporteurs on the Right to Health, UN Special Rapporteur on the Rights of Persons with Disabilities, and UN Independent Expert on the Enjoyment of Human Rights by Persons with Albinism. Can we go? Thank you. So the survey was published online, and it was translated it was available in 25 languages. It was also disseminated through the coordinating group's international networks, online and also in Word format, so that we could reach people who don't have direct access to internet. The survey remained open for 3 months, and we collected 2,152 responses from people in 134 countries. So we received an overwhelming number of responses for persons with disabilities, and then the representatives of organizations as well as family members. There were also open questions in the survey, which enabled us to gather more than 3,000 written testimonies documenting the experiences of persons with disabilities and their family members during the pandemic. Thank you. To identify, so the survey had 2 goals. And the first one was to identify what states were doing to protect core rights of persons with disabilities, and that including the right to life, access to health and essential services. So part of the survey was identifying these issues, and another goal was to highlight particular issues which persons with disabilities of heightened vulnerability were facing. So this included people living in institutions or their own homes, children with disabilities, especially those in residential schools, older persons, and also it included questions about persons who are homeless and people in rural settings. I made 3 different questionnaires. One was targeting governments, and the aim was official information. The second questionnaire was targeting national human rights monitoring mechanisms, and the third one was for persons with disabilities to enable them to share their experiences during the pandemic. The key findings will be presented in the report, which will be released next week. But the 4, let's say, key themes that emerged during the survey, and thus these represent the core structure of the report, are the inadequate measures to protect persons with disabilities in institutions, the significant and fatal breakdown of community services, community supports for persons with disabilities living in their own homes, the disproportionate impact of underrepresented groups of persons with disabilities, and also the denial of access to healthcare. These are four major themes that emerged as a result of the survey. So here I was asked to focus on our findings when it comes to people who were detained in small and large institutions worldwide. So the findings suggest that governments have failed and have failed around the world equally in all because we gathered responses from all over the world. So the governments around the world failed to protect the right to life of persons with disabilities in institutions, and both large and small scale institutions have become the epicenter basically of infections and death in many countries. We collect 329 written testimonies from 50 countries about situation of persons with disabilities in institutions. And the majority of these testimonies came from high-income countries, which are like Germany, Austria, France, and Canada. So the main conclusions were that the spread of COVID-19 has exacerbated existing human rights abuses, as institutions are in itself a violation of human rights. And they failed to prevent human rights abuses. There was a huge failure to protect the lives, health, and safety. So persons with disabilities were not getting necessary information on how to protect themselves. They were not getting necessary information about the pandemic and what was happening outside of these facilities. There was a denial of access to healthcare. So many people have not received any testing or any treatment due to their place of residence. And there was also ban on on visitors and also isolation of residents when there was during the outbreak of COVID-19. So these are some of the findings that you will be able to learn more when the report is published next week. But for example, 33% of respondents said the government took no measures to protect lives, health, and safety of persons with disabilities living in institutions. Similar to that, 44% of respondents said that the governments took no measures to protect children with disabilities in residential schools. Testimonies is something that we paid great importance to. So here I shared one of the quotes that says that, which came from the institution in Quebec, in Canada. And the testimony says that the other residents were malnourished, dehydrated, and severely neglected. The institution was dangerously understaffed. There were people dead in their beds, others laying on the floor, and some others with 3 layers of diapers and dehydrated. So we received plenty of testimonies. However, what I want to stress is that comparing to the overall number of responses, very few came from persons with disabilities living in institutions themselves, which shows us how hard it was for them even to communicate and to get information from the outside world, so to say. So one of the biggest impact, apart from violation of the right to health and safety, was social isolation by which persons with disabilities were affected. The survey addressed 3 issues. One was where residents were banned from leaving the institution, another were friend families, and others were banned from visiting social care settings. and also where people, friends or family are banned from visiting psychiatric institutions. So we received different testimonies from all over the world. Here I chose three quotes, one from a Bulgarian organization. They feared that the measures that were taken to prevent infection could also lead to lack of care, lack of transparency, and concealment of dangerous abuses, because there were no monitoring mechanisms able to access institutions during the pandemic. A Greek organization of persons with disabilities described psychiatric institution as hermetically sealed with more absolute restrictions than before, with no possibility of visits, with no advocacy services, and no independent monitoring. And one of the German respondents feared that the measures may help to prevent infection, but the psychosocial impact on people cannot be underestimated. Can we move to the next slide, please? So coming out from the survey, we addressed recommendations. Package of recommendations was focused on emergency response, which was needed to avoid further catastrophe. So the main one is to develop an emergency deinstitutionalization plan in line with Article 19 of the CRPD and General Comment number 5, Right to Independent Living of the CRPD Committee. Implement an immediate no admissions policy to large and small scale institutions, to closely monitor the situation in institutions and release data and information on the number of infections and fatalities, guarantee immediate unfettered access to independent national human rights authorities, including national human rights institutions and national preventive mechanisms, to ensure their access to all institutions, and to provide immediate access to food, PPE, social distancing measures, appropriately trained staff, to provide accessible information in multiple formats about the state of emergency. Next slide, please. Ensure full access to healthcare on an equal basis with other citizens. Implement immediate measures to ensure that residents can contact law enforcement and complaint mechanisms. Ensure that people within institutions have access to mental health support and services, and to prevent family separation and institutionalization of children or parents with disabilities due to COVID-19 pandemic. Disability Rights Monitor also is calling on governments to take longer-term steps to avoid future human rights emergencies, and we addressed two recommendations. One is to actively involve persons with disabilities and their representative organizations and civil society in planning the recovery process and emergency deinstitutionalization plans. And the other one is to allocate adequate financial and human resources to support the transition from institutions to the community in line with Article 19 of the CRPD. So to date, during the survey, our coalition has widely disseminated the findings. We released 3 emergency statements while the data analysis was still ongoing, and this was based on the issues that emerged as very important during the survey. One statement was focusing on ending catastrophic human rights abuses in institutions. One was to call for ending police violence and brutality. And the third one is to ensure access to food, medication, and other essential supplies. The urgent action was also initiated concerning the situation in residential institutions and calling for persons with disabilities to be immediately provided access to COVID-19 treatment in Romania. And also we submitted a written submission at the opening, and also a presentation at the opening of the 23rd session of the UN Committee on the Rights of Persons with Disabilities, where we presented preliminary findings of the global survey. And so I would like to call you to register now and to be able to hear more about testimonies and findings of the survey. It will be held next Thursday, 22nd of October, from 3 to 5 p.m. Central European Time.